A lot of dentists don't realize the importance of oral prophylaxis, which is normal cleaning. Something in the mouth where a cavity could happen. We're like the traffic cop. We're waiting behind the signal. We're waiting right behind the turn. आप बाल काटेंगे, बाल आ जाएंगे. नाखून भी काटिए, नाखून भी आ जाएंगे. आप चमड़ी भी काट के लाइए, चमड़ी भी आ जाएगी. आप हड्डी तोड़ के लाइए, 17 हफ्ते में आपकी हड्डी भी जुड़ जाएगी. लेकिन दांत में सड़न लेके आएंगे ना, वो दांत वापस नहीं आने वाला है. तो आप पहले आके दांत के डॉक्टर को दिखा के जाइए अपने. We need a chair, we need civil work, we need plumbing.
We need 500 items.
There's this common thing which every dentist must have heard. दांत निकालो तो आंखों की रोशनी जाती है. And then I asked them, what about patients wearing complete dentures? वो तो अंधे होने चाहिए. You know you are able to positively change people's lives. Why not share that? A candle's light does not go down by lighting another candle.
Very well said. Hi guys, welcome back to the MADtherapy Sessions podcast. Our guest for the 17th episode is Dr. Manoj Shroff. Dr. Manoj Shroff is a general dentist who's a firm believer in preventive and conservative dentistry. He's the head dentist and the owner of the Shroff Clinic in Mumbai. So Dr. Manoj, you were in the first batch, the first BDS batch of MGM Dental College. How was the whole experience?
Yeah, we were the first batch of the dental college. Let me take you back through time.
Okay.
You're just a fresh 12th standard graduate, and you're put into a new place, a new institution where teachers are new, the infrastructure is new, everything is new, and you have to now study medicine. And you know about anatomy in the first year.
Yeah.
And they have an entire medical hospital that's attached and that's fully functional. And you're the new batch, which is an outlier. Like nobody knows what's this new batch of students doing here.
Yeah.
And then you have to go from one department to another saying, you know what, we're dental students. We're the first batch of this dental college. It was an experience.
Yeah.
It was a good experience. But on a positive note, we did get to see a lot of things which maybe people of other dental colleges may not get exposure to. For example, full access to medical and surgical wards in the third year, full access to the casualty and emergency in internship.
Okay.
Like our batch got to do everything from scalp sutures to catheterization to assisting in the OT, the main OTs. So it was a good experience, I would say.
I mean, people can just dream of doing that right now during BDS days.
Yeah, and because we were just outliers and the medical hospital is fully functional, they had no other option but to just tag us along with themselves. So we got a lot of experience, which we were lucky to get at that time, but we didn't know the value of that. But today we realize the value of that.
And how was their response, the MBBS guys' response? Because, I mean...
हम सौतेले बच्चे हैं, कहाँ से आ गए ये सौतेले बच्चे?
No, but like... were they helpful? Were they...
Of course, they were helpful. A lot of them are very close friends even today.
Okay, that's great. And when you passed out, like as the first batch of the college, did you get any special treatment, like a guard of honor or something like that?
No, we didn't get any guard of honor. We were just happy to graduate. It was not easy. It was very difficult. I take great pride that हमने वो 5 साल निकाले हैं पहले attempt में. So it was an experience.
So what do you think is the difference in dentistry back then and today?
They have a lot more technology today, I would say.
But
we barely had cell phones at that time. We didn't have 3G. We didn't have 2G. We didn't have full-fledged access to the internet to look up things. We had to keep borrowing books from the library and read things that we didn't understand. We didn't have that much of access to YouTube. So exposure limited tha, I would say. Everything was from the books. Everything was from paper. We learned by opening and reading books.
So, but that must be I mean, now when you have apps where the entire books are there in a small phone, how does it feel? Like, because you have seen the transition happen, yourself in the past 2 decades, if I say.
Yeah, more than a decade, but not 2 decades. But yeah. It feels good to see where we've come from. It feels good to see the path we're on. It feels promising to see the path we're going to be going on. And it's very promising.
Okay. what do you think is one major shift which has happened in dentistry per se, back when you were doing BDs and back when you see it happening right now?
I think then I'm not so sure, but dentistry back then may not have been as commercialized as it is today.
Okay, what do you mean when you say commercialized?
It's become more like a Kirana approach today.
Okay.
Like everything, we didn't have Google as strong as back then as it is today.
Okay.
So Dr. Google, apparently patients have a lot more faith on Dr. Google than they have on their actual doctor. So a lot of times we have patients coming in saying, I need a crown, I need a root canal. I mean, you know you need a root canal. Seriously, then what am I doing here? Am I just a person who will execute the task? So yeah, that's been a shift. I've seen it, while it's a double-edged sword. Like people are more aware, but also they're being misled by advertisements. So yeah, it's become more commercialized, is what I would say. Navigating through the nuances of dentistry being commercialized in today's age is a challenge.
Okay.
Yeah.
And what was your favorite BDS posting?
My favorite BDS posting would have been conservative dentistry and oral surgery.
Any particular reason why?
Our teachers in those departments were pretty inspiring, and they were very passionate about teaching us, and it was just fun being in a department where someone takes interest in teaching you. Not that the other departments were any less, but teachers in these two departments stood out, for me at least.
You could feel the passion flowing through them.
Yes.
Great. And like, what was it about? Like, apart from teachers, any particular reason why you love conservative dentistry?
I had heard this analogy once from someone in a talk in one of the conferences, where this guy said that we dentists today have become such that we notice something in the mouth where a cavity could happen, but we're like the traffic cop. We're waiting behind the signal. We're waiting right behind the turn where the person skips the signal and then you find them. Like, you're waiting for what? You're waiting for the bite to collapse. You're waiting for the tooth to get decayed. You're waiting for the person to make a mistake and then intervene and perform corrective action. Like, why can't you perform preventive action? So in our practice, I run a private practice. I'm a full-fledged private practitioner now. So our approach is extremely dedicated towards preventive and conservative dentistry. I would say much more than interventional and corrective dentistry. While there is a part for people who need that kind of intervention, it's more focused towards preventive and conservative dentistry.
So basically you act like a gatekeeper, like, before any major flare-ups happen, it's better to do a preventive treatment of the patient.
Definitely, yes.
And that has been your approach. I mean, that's what you have learned way back in college and you've applied it, and now it's being successfully a part of your practice.
In a way, you could say yes. So in the last 18 years, what I've learned is, so I'm going to say this in Hindi. This is what I tell patients in Hindi. आप बाल काटेंगे, बाल आ जाएंगे. नाखून भी काटिए, नाखून भी आ जाएंगे. आप चमड़ी भी काट के लाइए, चमड़ी भी आ जाएगी. आप हड्डी तोड़ के लाइए, 17 हफ्ते में आपकी हड्डी भी जुड़ जाएगी. लेकिन दांत में सड़न लेके आएंगे ना, वो दांत वापस नहीं आने वाला है. तो आप पहले आके दांत के डॉक्टर को दिखा के जाइए अपने. तो आइए दवाखाने में 6 महीने में एक बार हमें अपने दर्शन दीजिए, and let us serve you. So it's more of a conservative approach.
I love that approach. So what are the preventive and conservative measures you take in your private practice? Which, I mean, for us, it can be helpful, like young dentists like us. I mean, younger to you, okay? Younger dentists.
Thank you for correcting. Younger than me. I've noticed 2 important things. A lot of dentists don't realize 3 things rather. I'd like to rephrase myself. 3 things. A lot of dentists don't realize the importance of oral prophylaxis, which is normal cleaning. It's highly underrated, and that's why patients are not made to understand the importance of that. Preventive sealants, even in adults, and occlusion.
Okay.
Yeah. People don't understand occlusion. Dentists don't understand occlusion. How are you going to make a patient understand occlusion?
So those are the 3 things which you think a private practitioner should focus on
first to understand themselves, undergo extensive training themselves, understand these things so that you can explain that to your patients, so that your treatment plans can be focused in a more conservative manner. Vaisa.
Understood. So again, you have stuck to general dentistry. I think after BDS, you did not master in any particular field.
Yeah.
You are more into general dentistry. And any particular reason or reasons why?
I had
General
a couple
dentistry.
of options to go in for masters, but there were multiple reasons why it did not work out, that I
Okay.
was unable to go and pursue a master's degree.
But you wanted to.
I wanted to, for sure.
Okay.
But a master's degree per se was not something I was able to pursue, but I have pursued extensive continuing education in the form of postgraduate certificate courses and diplomas and fellowships after BDS. But yeah,
But looking back now, did not do any masters. You have stuck to general dentistry. Are you
even
okay?
if I would have done masters, honestly, I would have been a general dentist first, and then I would have been a prosthodontist or an endodontist. Then, general dentistry is underrated. It's important. It's not given as much importance as it needs to be given.
But are you happy with your decision right now?
I am super happy with my decision. Imagine if I was an orthodontist, I would be seeing only patients who come for braces.
Yeah, true.
But as a general dentist, I get to see children, adults, geriatric patients, everything.
You're like the gatekeeper. Like the patient, the first point of contact for the patient is you. And then, you decide what treatment, what line of treatment should the...
That's another thing that's another good thing that you mentioned, the line of treatment. So I've realized one more thing along the way. There's no right treatment and there's no wrong treatment. For example, even in the city, if I want to travel from point A to point B and I were to ask 3 people, yahan se wahan kaise jana hai? If someone suggests taking a bus or someone suggests a cab or someone suggests walking, it doesn't really make a difference. It's just a difference in approach. But experience will help you determine the most efficient and appropriate line of treatment for the patient.
Yeah.
Which is why we don't have college placements when it comes to dentistry. Because in college placements, agar dental colleges mein karenge, the main factor that's missing in a fresh dentist is experience.
Yeah.
Yeah, so you need that experience first.
Understood. Coming back to why dentistry? Why did you choose to become a dentist? Like you always wanted to become one, or it just happened along the way?
I did know I wanted to get into medicine. My mother's a gynecologist and a general physician. So I was always inclined towards becoming a doctor. Had given 11
You're still a
different...
doctor.
Huh?
You're still a doctor.
I am a doctor, yeah. Dentists are doctors.
I was kidding. Please carry on.
Yeah, so I had given 11 different common entrance tests at that time. And in Maharashtra's common entrance test, I got the most favorable marks. And that was the closest to home. So I didn't really want to relocate to another state in the country to study medicine.
Yeah.
And I was like, one fine day, if you do take up MBBS, you would probably then do a specialization in maybe cardiology or neurology or something. And you'll be seeing only a certain set of patients. Why not dentistry? Even here, we're going to see a certain set of patients. Now, of course, at that time, I had limited knowledge. I didn't know why MBBS is given first preference and why dentistry is given second preference. But I know the answer to that today. You want to take a guess?
I have no clue.
Try giving it a guess. Give it a shot.
I don't know. Money?
No. So I got this. So this realization dawned on me when we renovated our own practice to make place.
Investment? No.
Investment. You're pretty close.
Okay.
So a general physician, someone who studied MBBS, just needs a table and a chair,
Yeah.
a paper and a pen, and a BP apparatus, a sphygmomanometer, and a stethoscope. And 6 things, and you're set. But for us dentists, we need a chair, we need civil work, we need plumbing.
We need 500 items.
500,000 items.
1,000 items. Yeah.
We need to learn HR management, we need to learn stock management, we need to learn how to make treatment plans.
Accounting.
Accounting, time management, marketing, everything. everything. And we're supposed to be surgeons also at the same time.
Yeah.
And constantly keep upgrading our skills. And you know, dentistry is not a two-handed job. It's a 4 or sometimes even a 6, or in surgeries even an 8-handed job. So that's where I understood that, yeah, that's why dentistry gets second preference, but I'm super happy with my choice.
Because that was my follow-up question. Are you happy with the choice of...
Super happy. Super. I'm a surgeon at heart, and I'm super happy with this.
Any particular reason why you feel proud as a dentist? I mean,
Why do I feel proud?
or what motivates you? Like, like you say, why do you keep coming back to a practice every single day? I mean, what motivates you?
We have a practice in South Bombay, and as nice as South Bombay Sobo sounds, there are a lot of people who are still coming into our practice who've never been to a dentist before. There are an equal number of patients who've been to dentists before but have not been given proper guidance. Just setting someone's thought process straight, getting their smiles in order, giving them a proper treatment plan, guiding them, and helping them transform their lives and the lives of the generations thereafter in their families. I think I don't need external validation. I think I'm happy with just doing this much.
That sounds great. What are the weirdest things you have come across, when patients, have told you about regarding dentistry?
There's this common thing which every dentist must have heard. दांत निकालो तो आँखों की रोशनी जाती है. And then I asked them, what about patients wearing complete dentures? वो तो अंधे होने चाहिए. उनको तो दिखाएं. But that aside, during the lockdown, there was this one guy who had toothache, and he calls me up and he's like, so I'm not making fun of anyone's accent. I'm not. But this is how the conversation went.
You can.
I'm not going to make
You're
fun
from
of...
Sobo. You can make...
No.
You can make fun of your own kind. You can.
No, that's the last thing you'd ever see me do. No. So this guy calls me up and he's like, Doctor Saab, दांत में बहुत दर्द है. And I'm like, ठीक है, एक क्रोसिन ले लो. आज के लिए एक क्रोसिन ले लो. And he's like, कहा बोले डॉक्टर साहब? Kerosene. I'm like, अरे kerosene नहीं, क्रोसिन. Did you get that?
Yeah, I got that.
Kerosene ले लो. Imagine even I've taken kerosene. Not kerosene, kerosene.
So, it sounded like kerosene basically.
Yeah.
But then, any other? I'm sure you have many.
The list is endless.
Just one more.
So I have a habit of using cheek retractors when I work, so that I get obstructed access to the mouth. And there was this, and we need to use petroleum jelly before we put on retractors for a patient. And there's this lady who's like, Doctor साहब, दांत में बहुत दर्द हो रहा है, ईका लगा रहे हैं आप, मैडम आपका दांत, she's like, सर फटे जा रहा है, आप ईका लगा रहे हैं, दांत का इलाज तो कीजिए ना. I'm like, मैडम सर फटेगा पर आपके होठ नहीं फटेंगे.
Did she laugh at it or did she understand the joke?
No, until I gave her anesthesia, she didn't understand that. After that, she understood.
Coming back to dentistry in college. So there are a lot more girls in dental colleges than guys. What's your take on that?
I don't know why we have a lot more girls in dental colleges than guys, but there are a lot more girls than guys, and people think that it's an artistic field, so girls would do a better job, but I don't think that's the fact. I think I wouldn't be biased by gender. I just don't know why there are more girls than guys. But I think guys do an equally good job, sometimes even a better job.
Yeah, but what do you why do you feel? I don't complain. There are more girls than guys. But there must be a reason, and it's not a recent phenomenon. I think most of my friends in my entire friend circle, if I were to think about them, most of the guys who have gotten into dentistry are the ones who have been able to set up their own practices. But girls who I know, in my knowledge, have entered dentistry have rather become consultants, and they consult from one clinic to another.
because they're not sure where they're gonna marry and if they're gonna settle down in one place. So I guess probably that's why they take up dentistry. Probably, I'm not so sure. Maybe we should ask your viewers to put that in the comments.
No, but like, because even I thought about it, I never like one was that artistic answer, but that's not the case. Like,
It's not the case.
But apart from that, like, I mean, I'm sure the amount, like, the number of boys must have increased now. Like, we were around first year, we were around 120 students, 105 are girls, 15 guys, and out of 15, to 4-5 aate hi nahi, we're down to like 10 guys.
Yeah.
It's like crazy ratio.
Yeah. Yeah.
Also, wanted to ask you, what's your favorite oral healthcare brand? Something which you use often.
Oral healthcare brand. There's not one particular brand per se, but I'm a big fan of Colgate. They come up with newer and innovative products.
Okay.
They recently came up with with a toothpaste dedicated to diabetics. Then they came up with a toothpaste on an Ayurvedic formula. Then they've come up with this Ved Shakti mouth spray. I mean, there are a lot of other good companies, but these guys keep coming up with something new every 3 months.
Like, they understand the Indian market, what the...
Yeah.
So, any particular product which you love about them, about Colgate, which you use often or you recommend to a lot of people?
I'm a big fan of Colgate Total and Pepsodent G.
Okay.
Because that's one question which everyone keeps asking. Doctor साहब, टूथपेस्ट कौन सा लेने का? I'm like, धोबी को कभी पूछते हो क्या कौन सा कपड़ा धोने का, साबुन लेने का? You just wear clean clothes, right? You just brush after every meal.
Yeah, but there are so many toothpaste in the Indian market that even the consumers are going to get confused, like,
I think a pumice-based toothpaste is the best, like Pepsodent G or Colgate Total. I'm not a big fan of gel-based toothpastes.
Okay.
Yeah.
You don't like the way it feels in the mouth, or...
I'm just not so sure if these toothpastes do a good job in removing all the plaque and calculus.
They're more just for placebo effect of, like, creating that...
There was a brand, I don't want to mention it, but it had such a feel-good feeling after using it.
You can mention it if you want.
No, I don't want to mention it.
Unless you don't want to cross paths with them.
I don't want to cross paths with anyone.
Okay, understood. But you can mention it.
But then when I ruminated over it, I realized this contains so much more of camphor, and that astringent effect is so strong. I'm not so sure if it's really cleaning. It's just making me feel good. But
the after effect is really nice, but then you're not sure whether it actually cleans or not.
Yes, like as a fellow dentist, you would understand we use stains to even stain plaque and calculus and pre and post scaling. We know how to judge whether some product is doing its job or not. So I'm a fan of pumice-based toothpaste, you could say.
Fair enough, like, So, and that's what you recommend to people. Okay, understood. What's your favorite dental instrument in your clinic?
My favorite dental instrument in the clinic? That's a good question. I think that would be my intraoral camera.
Okay.
It's not really a dental instrument per se, but it's an instrument in a dental clinic.
Yeah, it helps you in your daily practice.
Yeah, it kind of helps me show people what I see. It helps me document a case, and it helps people understand what we've done for them in an appointment.
And it freaks them out also, like, oh, ye hai mere daant.
Ye mere daant hai.
Yeah, like that.
Yeah.
But I understand, like, so that's one reason, right? Like, any other instrument you would want to, like, mention? Give a shout out to, like, any dental instrument, like, you recommend people to buy, like, you recommend fellow dentists to buy. Ye le lo, it's really nice, it works. Like, for example, I tell people to buy the Hand&Crat front surface mirrors. I love it. I mean, I'm using this since last 7 years now. And they're light, they're, front surface, so they don't have that ghosting effect. And they're clear, and they have this pastel colors. So, that's what I recommend to other dentists, like, if anyone asks me. So, anything which you recommend to people?
I think something as simple as a cheek retractor is underrated. I would really want more dentists to start using cheek retractors.
Okay.
And one more instrument deserves a mention, an apex locator.
Okay.
And you know the reasons why. Dentists who are watching this will definitely understand why I said apex locator. And cheek retractors is highly underrated. Start using cheek retractors for every case from now on. Yeah.
Got it. Also, like, we had such a huge almost 2 year lockdown because of the pandemic. How did the pandemic change your practice as a you as a dental practitioner, or even say just as a mentally, did it affect, how did it affect you?
I've been a hardcore dental practitioner for the last 13 years.
Okay.
I never once thought I would shut down my practice for 6 continuous months. The pandemic kind of overhauled everything that I knew about dentistry and practicing dentistry. Our entire practice has changed. Fumigators, we never knew. Now they're an integral part of the life. Okay. B-class autoclaves are run daily in the clinic. There's no substitute. There's no alternative to that. Barrier films, surface films, हर एक surface के change होने ही हैं. So these kind of we used to wear aprons which we would reuse. Now we wear what are those gowns called? The ones with the laces at the back.
The disposable kit.
No. The gowns at the back which are what? There's a name for them. Gowns which have the lace at the back.
Yeah, something
So the front slip-on gowns.
like
right?
what you wear for surgery, right?
What the surgical gowns, yes.
Surgical gowns,
Gowns. So for every case, whether it's a checkup, whether it's a surgical procedure, gowns are a must. The whole operatory functions differently. Staff is trained differently. Thought processes have trained differently. Staff undergoes a way more rigorous training when it comes to sterilization protocols. It's overhauled dentistry, I would say. We're no longer the same clinic. The premises are the same, but everything's changed.
And how has it changed you as a person?
I think it's given me a lot more appreciation for everything, including what we and our team does. Like, people outside are wearing masks and even talking to one another, and here we are working inside the mouth. Like, we're actually going inside Kurukshetra and we're working. I think it's given a newfound respect for all fellow dentists and their teams. Wouldn't you agree with me?
Yeah, I completely agree with you. I mean, and people still don't appreciate the fact that we are taking so much risk to, so it has an impact on you, right?
Yeah.
And do you think it's going to continue? I mean, are we going to go back to our old practice after some time?
I heard a senior speaker speak once that in the 1970s, not every dental practitioner wore gloves. Of course, I was not born then.
Yeah.
When I started practicing dentistry, wearing an apron was important. But I think these full gowns that we wear, surgical gowns now for even a checkup, and shields and double masks and B-class autoclaving after every patient, I think this is here to stay from now on. I think
it's the new standard now.
It's the new standard. We've changed. We've changed.
Got it. What do you do when you're not in a clinic? Because I'm sure you are there in a clinic a lot more than you should be, but then when you're not, what do you do?
There are only 3 places you'd find me if I'm not in clinic. I'm either sleeping or cycling or in the gym.
Okay. So 2 are physical activities and 1 is
Sleeping, cycling, gymming and clinic.
So is this something which you do daily?
Cycling is something I try to do daily. Off late, that's taken a back seat. Gymming is something I do daily. Sleeping is something I do daily.
Okay. Are you like a TV show person or something like that? Do you?
I used to be a TV show person, but
You've reduced
a lot.
Okay.
So now it's just Netflix on the phone whenever I can.
Okay. And what are you watching on Netflix right now?
There's this beautiful thing I've started watching. It's called Tales of the City.
Tales of the City. Okay.
I finished watching Emily in Paris.
Okay.
Then there's Coming Out Colton. And what else? There was this good thing, Star Trek.
That's a classic.
It starts with A and I can't remember that. Star Trek Enterprise, yeah. Enterprise, not A, Enterprise, yeah. That's a classic.
Those are the shows which you're watching right now.
Right now.
Okay.
One more thing. This needs a mention.
Okay.
Kim's Convenience.
What is that about? Kim Kardashian?
No, it's not about Kim Kardashian. It's about this South Korean family that's
Okay.
migrated to Canada, and they run a convenience store, and it's a blast. You just gotta watch it. It's funny. It's lighthearted, and
Is
it's
it
just
like
relaxing.
comedy?
Yeah, it's relaxing.
Okay. Are you like a music person?
Definitely.
Okay. What's like your favorite genre right now?
So one good thing about music is that we've got. So whenever a patient walks into our clinic, we tell them that you can play the music of your choice on the smart speaker.
Okay.
So I get exposed to a lot of different kinds of genres of music via patients.
So which app do you like?
We've got Google, we've got Alexa in the clinic,
Yeah, but which app do you like? Which app do you? Which music app do they?
Spotify.
Spotify. Okay.
Huh. So the patient would just tell them, play this song, play this artist. So there was this patient who asked for this artist called Earl, Earl, and I've become a big fan of Earl of late.
Okay.
Yeah.
That's an interesting thing. Like finding new music through your patients.
Of course, because patients choose the music, and then while we're working, they're almost asleep. Like मुंह में retractors हैं. Patient's mouth is open, and they're so relaxed, and they have faith in the doctor, and then in the team, and it's super quiet, and it's comfortable. And for half an hour, if the procedure is gonna last half an hour or 40 minutes, the patient actually just conks off. I'm listening to their music while they're sleeping.
Okay. That's beautiful actually.
It
'cause
is.
Then the patient's silent. You're getting to do your thing,
Yes.
and plus at the same time, good music.
Yes.
So you were, say, like working as an associate and as a consultant dentist for quite some time, and before you took the jump of going into a full-time practitioner. Why is that? Why did you take a break after doing a BDS? Break in the sense, ideally there are two options. You complete a BDS and then you put your own practice immediately, or you work under someone. So you have done the other route where you have you're working for other people, under other people, working as a consultant, and then you took the plunge of becoming a full-time practitioner.
Yes, I did do that. And I am happy by what I did, by my choices in the past. I think it's important for every fresh dental graduate to first unlearn the things that need to be unlearned that we're unnecessarily taught in college, with no due disrespect to anyone from the faculty who's watching this. I also think private practice teaches you a lot more things that college cannot teach you at all. So that's important. I picked up practice management skills from so many different places that I was consulting at, and that gave me an opportunity to learn things that you need to do correctly. But more importantly, it taught me things that you should not do when it comes to private practice. And of course, when I'm consulting in a clinic, I don't have a real say in their management. I'm just someone who comes, works on the patient, and I'm out. But that kind of prompted me that, why don't I start a practice where I can address all of these issues? For example, I'll give you two examples. There's this misconception amongst people that they say that once we go to a dentist, it's just expenses. एक बार दांत के डॉक्टर के पास जाओ, पैसा खर्च ही होता है. Anyone who comes to our practice, the Shroff Clinic, on the first day is given a pre-treatment counseling and quotation form. Take it. This is all the treatment that you need. Once this is done, a 6-monthly follow-up is all that you need. The time and the cost for everything is given on the first day. Now it's their choice if they want to come or no. Second thing, patients say, अरे क्या दांत का इलाज करा है? What did you get treated for? I don't know. Something was done. I don't know. Something was done. Why do you not know what was done? Every patient who comes to our practice, before and after their appointment, is shown x-rays and photographs of everything that we're going to do on that day. I think that most of the patients who pay attention to what we counsel them become half dentists by the time they're done with their entire dental treatment. I believe this creates a greater awareness in the patients and greater sense of appreciation for why they're coming and what they should do once they go home and what they're doing with us in the clinic.
And the trust also increases,
Definitely.
Once you make them a part of the treatment process.
Definitely. They need to understand why we're suggesting what we're suggesting.
So ideally, what would you propagate to a fresher who's just out of college, would you tell him or her to take some time off, unlearn new things, and then take a plunge? Or if the time permits and if finances permits, they can immediately put one?
They can always go in for a property of their own, but they don't really need to start full-fledged private practice of their own right after graduation. They need to work under people. They need to work in different dental practices. They need to unlearn things they learned in college, and they need to learn newer methods of practice that other practices are employing. And that's where they will then understand what they should and should not do in their own private practices.
Understood. Fair enough. What do you think are the key following up to that, what are the key factors which a young dentist should consider when they want to put up their own practice?
It's an expensive field. It's not easy to start a dental practice on rent, at least in the Mumbai metropolitan area. No. Rent is too expensive. Properties are too expensive. If you have property on your own name, get into the practice. If you don't, reconsider.
And do what? Reconsider and do what? I mean,
get into academics, become a consultant. But starting a private practice is an expensive affair, at least in Bombay. Yeah.
But
I'm not so sure about tier 2 cities. I'm not so sure about the interiors of the country. Maybe then practicing private dentistry out there might be a lot more easier, but definitely not in our metropolitan area in Bombay.
But the sad part is they come to realize all this once they have graduated.
Once they have graduated, correct.
No one tells you in dental college. So, you get ample time to decide what to do. And by the time you're already out of college, it's a scary proposition where you don't know, you have limited time now to decide, like you said. And what if they don't want to get into academics? What if they still want to do clinical practice?
Most of these people would then branch out of dentistry into something like a master's or an MBA and get into an administrative or a corporate job, and they would give up clinical dentistry. And that's the sad part, that counseling is not given to people who are taking up dentistry as a profession beforehand.
Yeah. Understood. Looking back at your journey in dentistry, how do you feel? I mean, how do you feel about your journey as a dentist till now?
I feel happy. I feel fulfilled. I feel happy we've survived a pandemic. I feel happy for all the lives we've changed, for all the people's smiles we've touched. I feel fulfilled. I see where we had started. I see where we are. I see where we are going. It sounds very promising. It's very exciting. I see what dentists today are doing. I see what we can do with them. And it's just so promising. It's so promising.
That's great. Last question for you.
Bolo.
What's next for Dr. Manoj in 2022?
There's so many things on my mind. I'm not even sure where to start.
I'm all ears.
Well, for starters, we've already integrated an advanced endodontic practice into our clinic.
What do you mean by that? I mean, how when you say advanced?
Okay, so I told you in the start that we are more focused towards preventive and conservative dentistry. So designing treatment plans and approaches and dealing with endodontic and root canal emergencies and root canal complications and perfecting our art of saving teeth that a general dentist would otherwise not be able to save by conventional root canal techniques is something we're already in the process of doing. We just need to get the branding out and the marketing out for that and creating more awareness with patients.
That's one
thing. So advanced endodontic center to ho gaya hai. It's in the oven. It just needs to come out. We've also been training a lot of dental assistants. This has been on my mind to start a kind of a training institute of some sort for dental assistants.
Training clinically or
clinically?
Clinically.
Definitely clinically.
Because I see a lot of people. I mean, assistants and everyone, they're clinically sound, but then especially where we have worked, they should also know the other part, like the soft skills, something which you are great at. So you could even think about teaching those soft skills to them.
I'm not sure if you'd believe this, but people who join our practice on an average undergo a training of a minimum month and a half. That's around 6 weeks minimum before they're even allowed to assist on a patient. That's 1.5 months of,
That's
you're
crazy,
just going to
yeah.
be paid and you just got to come, sit, learn, observe and grasp all of this. And after that, we're going to assess how good you are in what you've been taught in the last 1.5 month. And only then would you be allowed to work on patients with the doctor. So that's something on my mind, but it's
So a training institute for a training sessions for
dental
assistants.
assistants. But that's not yet put in the oven. I need to put that in the oven.
Third point.
Third
What's
point.
next for you?
I'm not so sure I should say these things right now. They're still pretty premature. But
It's
I'm
fine. I mean, it'll serve like a record, like, like an archive. Like you had said that. So and it'll actually put pressure on you. Oh, I'm saying this on camera now, so I better do it. Like,
you know what's the third thing? You and I have a long history together. You know what's the third thing?
no, I really don't know what's the thing.
You want to make a guess?
Starting your own podcast.
Definitely.
Really?
We had this conversation around.
Yeah, but I didn't know
7
like
years
this.
back. You and I had this conversation.
Yeah, but I didn't know this was in the pipeline. It's okay.
This was one of the things.
Have you started working on it?
Not yet. Not really. No. But it's on my mind.
And why do you want to start a podcast?
Just to be able to reach out to more people, touch more lives and influence more lives. And if there's something I can give back and I can improve someone's life or thought process, then why not?
So, are you going to invite only dentists, or I mean, have you thought about it? Like,
No, I haven't really thought about it. No. But you're going to be the first one to get invited. Don't bother.
No, but I'm just thinking, like, because I'm excited to know, like, because I tell everyone who I meet and who have that sort of skills in them, I tell them, like, you have that in you. Just start a podcast or start something like on a digital platform.
I think it's more important for all dentists to share best business practices like it's done in the corporate world. I don't know why a lot of dentists and medical professionals don't do that. It's only restricted to seminars for certain A ward or C ward seminars. Yeah,
And it should
IDA
be
Bombay
free.
seminars.
Yeah, it should be free. Like,
It should be free, it should be accessible, it should be universally accessible. Like if there's something good that you're doing and if
it's working out for you.
and if it's working out for you and you know you're doing a good job and you know you are able to positively change people's lives, why not share that? A candle's light does not go down by lighting another candle.
Very well said.
Yeah.
Manoj. So on that note, we're going to end the podcast.
Yes.
And it was lovely talking to you. I'm sure it was your first podcast. So
It was a pleasure catching up with you, Arib.
hopefully again soon
Yes.
in further seasons we'll be having you and talking about more serious topics and
Yes.
more intrusive topics, more controversial topics too, hopefully in the future. Okay. Thank you so much. Arib.
Thank you.
How was it?
Did I smile a lot?
So what? A smiling face is always a good face to have.
I'm just happy. Scared.
Why scared?
I don't know.
People will judge you.